Good afternoon, everybody. Welcome. I am Madeleine Thakur, President of the Children's Movement of Florida, and I am thrilled to welcome you to Bosses for Babies Live, a webinar series at the intersection of business and early childhood. So the Children's Movement of Florida is the state's leading voice on early childhood. We champion the policies and investments at the state level that for high quality early learning, for healthcare access, for parent support. And we created a Bosses for Babies as a way to engage business leaders in boosting their workforce and contributing to community prosperity through family-focused practices. Meeting business leaders where they are, so regardless of their size, their resources, and their needs, they're able to affect meaningful change. Today, I get to spend the next 30 minutes or so speaking with Matt Love, President and CEO of Nicklaus Children's Health System, about his family-focused approach there. But before we begin, let's go through a few housekeeping items. We are using Zoom's live transcript today, so if you'd like to see closed captioning throughout the program, just click that CC Live Transcript button at the bottom of your screen. We are recording the webinar and broadcasting live on Facebook, so all of today's material will be available after the fact. And if you want to join the conversation, you can visit our website, www.bossesforbabies.com. Please make use of the chat function. Why don't we have everyone introduce themselves there right now? Tell us who you are, where you're watching from. And if you're watching on Facebook, let us know there too. We'll share your comments and questions with the panelists as we go. For those of us in Zoom, please use the Q&A function for any questions you have for Matt. We'll do our best to answer all the questions, but we can't guarantee we'll get to all of it right now. So let's get to it. Matt Love is President and CEO of Nicklaus Children's Health System. As I mentioned, they're the region's only healthcare system focused exclusively on children. An engineer by trade, he's been in the healthcare business for more than 20 years with experience in financial and operational leadership. He's been in pediatric health systems, adult health systems. He's a father, a grandfather, an identical twin, and he's a leader who understands the implications of employees who are navigating work and family life. So Matt, over to you. Your whole organization is about supporting children's health. And of course, there's more to it than what happens within the walls of your institution. How do you think about that? What's on your agenda for thriving children in South Florida?
You know, creating a healthy future. Thank you. Let me first by saying thank you for having me here today. I appreciate the opportunity to speak to you, Madeline, and everybody else. So, you know, for us at Nicklaus Children's, it's all about creating a healthy future for every child, right? We think of that within the four walls of the organization, but more importantly, outside of the four walls, right? And as we think about outside the four walls, it becomes about partnerships and collaboration and understanding the health needs of the children in our community. And so, you know, it's an important first step is to understand, you know, what those are. And so the community needs assessment. We're the only organization that does one solely focused on kids, pediatric healthcare. So a community needs a health assessment. We listen to parents, right? So much care, so much health, so much well-being happens outside of the organization. We have formal process like our Family Advisory Council, who are parents who are dedicated to our organization, who provide us feedback on what we do well and what we could do better, to be honest with you. There's nobody more important in a child's life than the parents, right? They're the ones that know, right? I mean, I'm a parent, you said, my gut says something's wrong with my child, right? And you just know it. And so following the instincts of parents, listening to parents is important, you know, to us in terms of those pieces. And so, you know, those couple ways of understanding how to create a healthy child for everybody in our community is really what drives us inside and outside of our four walls.
Right.
If I can, you know, maybe a couple examples, if I may. You know, we have a mobile dental unit who travels around the community. You know, in the 3 or 4 years that it's been in existence, over almost 30,000 treatments for kids in our community who otherwise would not have had some type of dental treatment, right? partnership like our Kids Safe Coalition, right? That's around water safety, car safety, injury prevention,
Mm.
right? We live in Florida. There's a lot of water around us, along those lines. And then lastly, our ENRICH Literacy Program, right? This one's pretty cool, where we take an important role in helping parents understand the importance of reading and literacy in a child's life.
So I want to talk more about the Enrich program, but I first want to ask you about this idea of early literacy. When you were a parent, was this on your mind? Were you worried about reading to your child when he or she was just days old? Or is this something new?
Yeah, so I think for a lot of folks who probably on this call who are my age, it was different back then, right? I was raised by a single mother, my brother and sister, who also happens to be a teacher. So the importance of learning and reading was really instilled early in my life. So when I had kids, that was an important part of their upbringing as well. But we didn't call it what it is today, literacy, and right, it was things that you just did. I remember, driving home from work a couple, many days, exhausted and tired, and saying, the last thing I want to do is spend, 45 minutes or an hour reading to my son or daughter at night, right? Day of meetings, day of, whatever it was that we did. But it was important, right? And so you dig down deep inside you and try to figure out how you get that. I think, reading literacy, it doesn't take a ton of resources, right? It's not super expensive. It doesn't take a lot of energy. It does take time. And time is one resource, one thing that's equal among everybody, right? Whether you're, wherever you're at in your life or your economic status or whatever, it's equal. You can never get it back. You can't buy it. And so I instill that upon my kids growing up, say, hey, time is important. It's one thing you can never get back and you can never buy. And so make sure you cherish it. And so when I put it in that perspective, spending
Mm.
that 45 minutes to an hour, almost every day, my wife and I, Lisa, it was important for us to do that, to read to our kids and make sure that they knew the importance of reading early.
Yeah. Well, so Enrich. This stands for Engage, Nurture, and Read to Infants and Children. It's been active for a couple of years now. Tell us how to get started and why, and how are you supporting families through this program?
It gets started in a really cool way. We're about an organization of people, right? Frontline workers, nurses, support staff. And so this idea has been around for quite some time around, how do we empower parents and the importance of reading. It really came together a couple of years ago, as you indicated, by one of our physician leaders who joined us, Dr. Simon Aftab, whose passion it is around literacy. And so the idea was born out of frontline folks. She really got the energy and the structure behind it, in order to keep it moving and get it going. We know that, the health of a child doesn't just, happen inside the walls of the hospital. It actually starts at home. And so encouraging parents, providing resources. The literacy program touches a lot of kids throughout our organization, throughout the community, in terms of being able to spend some time hearing parents spending time with their kids in terms of the reading side of things. It takes a village, right? This
Right.
is something that we're not going to do by ourselves. And so I'm very proud that Nicklaus Children's is part of that village, is going to make this movement go forward.
And so, what is it? I remember a colleague came in to our office one day with a box. I think you call it a library kit. But what are you when you say the parents are being touched? What are they getting, and how does it work?
All right. So it started out, I don't want to characterize it as a box. I think that's the physical thing that gets, right? It's around the energy, the excitement around literacy. It
Mm.
happens to come in a box. It has books in there. They're bilingual, that we provide parents. It started out early, where we just did it with our inpatient patients. Kind of a controlled pilot, if we want to characterize it that way. But it's more, it's a box, it's an attitude, right? It's a culture around how do we help parents know the importance of literacy. And so again, it started out by just us working with our inpatients, through the main campus. We've expanded it over the last couple of years. And this is where, I think this is really cool. We're also an employer, right? And a lot of our employees are moms and dads. sometime for the first time. And so we recently expanded this program where we now give the box as well as everything else that goes with it in terms of the energy, the excitement, to every single employee who has a child while they're with us. And so that's pretty cool. And to me, that touches more than just the person that works for us, right? We're all about the family, right? It's the Nicklaus Children's family. And you'll hear me talk a lot about that because I'm really passionate about not just the employee, but everybody else that's part of that family unit. Because,
Right.
We're a whole person when we go home. And so those are some of the things that we're doing. And then lastly, we're getting ready to expand it with other partners, right? So if folks are interested, we can hook them up and provide as another employer some resources to help you or your organization, have this program at your organization.
There are so many things I love about what you just shared, because when you talk about the attitude and the culture and understanding of literacy, if you hear about this from a doctor or a nurse, when you're in that room with your baby for the first time, that's a trusted messenger. That they have the best interests at heart, that they understand child development, and it's refreshing to hear that message in a hospital setting, but also just so beautiful the way you've talked about expanding it internally and externally. And your employees, people think of a health system, they think of the nurses and the doctors and the support staff. But my understanding is you've got a whole lot more employees when you think about the facilities and other departments, and you're sharing that with everyone.
Yeah, this goes to everybody who's part of the Nicklaus Children's family. I mean, again, people think about the nurses and the doctors, and they're wonderful, right? The frontline staff. But it takes a whole family to make this organization run on a day-to-day basis, right? And it's a magical place. I always want to use my words carefully, but taking care of kids, there's nothing more rewarding than that, right? And so from the EVS folks that come in and clean the rooms and work extra hard, right, to the food and nutrition folks that serve our patients and our families and our workers, the facility, everybody is part of the Nicklaus Children's family. So this is for everybody. It's part of our organization.
Yeah. Well, and as you said, it's open to partners outside. So I know you have a presence in what is it, 7 counties in South Florida, and we'd love to share. Julie Katz on your team, I think, is the person to contact if someone's interested in bringing this box and this attitude for their own employees as a way to celebrate when there are new family members on their teams. So I know we'll share that in the chat. So if anyone is interested, if there's a Chamber of Commerce that wants to learn more for their members, please, Julie is the person to contact.
Yeah, she does a wonderful job. She's our executive director of community affairs and corporate responsibility. I don't know if she was expecting us to announce her today, but I know she'll be very happy to connect with folks and make sure that what we've learned we can share, and what we can learn from other folks. I'm very happy to learn from others as well.
Well, there she is, whether we've surprised her or not. She's saying in the chat she's looking forward to connecting. So Matt, again, great to hear you're looking outside and in to expand the reach of this really special initiative. When you talk about the family, the Nicklaus family, are there any other internal changes you've made to acknowledge parents on staff, to support families? When you think on the HR side, for instance.
Yeah, as I said before, part of what my responsibility is for the organization is to look out for the best of our Nicklaus Children's family. Right, we have wonderful people that work at the organization. They're really the heart of the organization. In a hospital, taking care of kids, right? It's all about the people. And so, yeah, we've done quite a few things related to, looking at our Nicklaus Children's family, ranging from, let's call it the traditional benefits and the total rewards package. Every year we take a hard look at what we can offer to our employees and make sure that it's competitive. We realize that people don't come to work, just for a paycheck. At least for Nicklaus Children's, it's more than that. But getting, the right rewards and the compensation is important. So taking a look at that holistic view in terms of the medical, the dental, those types of things that wrap around it. We also have an employee assistance program, which I thought was pretty cool. It ranges anywhere from mental health, helping with mental health issues and challenges that some of our employees may have, all the way to helping them find a dog sitter. So you think about, those types of things that when you need something, think of it as, we're not calling HR, right? We're calling a family member to help us. And so that's important for us as we take a look at what we're doing. This year, we also raised our minimum wage. I think everyone in Florida is aware that there's a requirement to do that in 5 years. I'm happy that in September of this year, we raised it to over $15 an hour for everybody, 5 years ahead of time. We know how, the importance of some of those frontline folks, those entry-level positions, how hard it is. And so I'm happy that we've been able to do some of those changes for some of the posts that has the largest impact to a lot of people on our.
Right. I mean, here's how we see it at the movement. When you have those kinds of family-focused practices, it decreases employee stress. It increases the amount of time and space they have to support their children's development. They're able to bring more of themselves to work, be more productive, be more engaged. And what you're doing is really increasing the economic security of the families that work with you, and also indirectly raising kindergarten readiness rates, because when you decrease that stress, when you allow for that time, and when you also educate about the importance of early literacy, you're making an impact community-wide for kindergarten readiness. On the other side of it, you talked about compensation package and benefits and all this. In the COVID environment, this is all even stronger in the news, thinking about the battle for the best talent. Have you made any changes because of COVID or with this in mind for what you've learned from the environment over the last couple of years?
Yeah, the last couple of years have been tough on everybody, across I think the country, across different industries. Healthcare hasn't been exempt from that. Actually, we've been on the front line of that in many different ways. And so, the pandemic has taught us a lot. So some of the things that we've been able to take a look at, like a lot of other organizations, hybrid workforce. And so being able to work from home, we do have accountants and HR people and legal and IT, not just the frontline caregivers. Of course, frontline can't work from home, can't work remote. I think they would go crazy if they were able to, because their passion is touching kids and making sure that they help them in the way. But hybrid workforce is an important piece of what we've learned. We've also learned the importance of celebrating the whole person, right? And so we started our September to Remember back in 2020. This is a month-long celebration of our employees, of our family members. In 2020, we did a food drive. And it was really cool to look out the window, because we were able to chance to go up to one of the buildings and see the line of cars of employees who lined up to receive food that was donated by other family members in terms of Nicklaus children. And it was just an amazing sight. This year we did our employee award night at the Marlins, right? And so that was, we had a whole section at the top where not only the employee came, but they brought their sons and daughters, their moms and dads, their brothers and sisters. I got to meet so many people outside of the employee themselves and their family members. And so really the importance of the whole person really, I think, came out during this pandemic. And I hope every organization is able to take a step back and say, that's what makes it, that's what makes it happen, right? If the employee's not we can't help the entire family, the entire unit coming to work and working hard during a time of high stress and a pandemic doesn't work. And so it's really a different attitude that our organization has taken forward as part of this, as part of the pandemic.
Right. Well, really important what you're sharing. I just want to remind everyone, if you have questions, please put them in the Q&A. We've got just a few minutes left here with Matt, but I know one of the examples that I always use, Matt, when we talk about Bosses for Babies is, yes, it's important what's written in the employee manual. And that is really important, having written policies that support your employees. But the culture side of it is a make or break. And I use the example of, I've got 2 kids under age 4, and there are a lot of pediatric appointments in those years. And it's one thing if I walk out of the office and say, oh, I'll be back in a couple of hours. call me if you need me. It's another thing if I say I've got to take Luke to the pediatrician, I'll be back in a couple of hours, but call me if you need me. And I always think of that second one of being open and transparent myself sets the culture that other people don't have to parent in secret. And that other, other folks on the team know that they can say when they've got a pediatric appointment. And it's just such a small thing. And really resonated with me when you talked about the culture that you're creating. But the other thing is, you've got within your organization folks for whom flexibility can be given to work from home and folks who can't. And I think so many employers across the state are looking at this of how do we support families for those essential workers who need to be physically present. And I'm wondering if there's any flexibility or additional supports that you've thought of, specifically for those who need to be physically present.
Yeah, you mentioned earlier, I'm first a dad and a granddad, right? So I'm so privileged to have that kind of perspective. And so I bring that to the organization every single day. I love to work. I'm privileged to be the president and CEO of a wonderful organization that takes care of kids. But I'm also a dad and a granddad, right? So, taking care of and supporting the folks because they're in different types of roles has always been a challenge, right? In terms of those pieces. But some of the things that we will be doing in 2022 really are some of the things leading edge, at least in the healthcare industry. So I'll give you two examples, if I may. We heard from our staff around doing a community involvement day, right? Taking a day somewhere in the community and doing something special, doing it as a group, doing it as an organization, being part of the community. And so that was part of what we heard, from folks, from frontline staff and others. The other is, we will be providing some type of assistance for childcare going into next year. So I know that can be popular or unpopular depending on, what year or what decade. It's kind of come and gone since I've been doing this. But we will be reinstituting some type of assistance for our folks from a daycare perspective. And then lastly, parental leave. We will be announcing, and it was recently approved, 4 weeks of parental leave. Right. So again, this isn't something that we had when my kids were born, but it's important, right? Those first 4 weeks, you can never get back. And so our ability to help support everybody in the organization, including those frontline folks that can't work remote, is a high priority for us.
Yeah, absolutely. Well, so great to hear. I'm not seeing any questions in the chat here, but I encourage you. You've got about 1 more minute left if you have one, everyone. Matt, I wonder if you have any advice for your peers in and outside your industry who are looking to support families differently in their organizations, businesses large and small, who think they can't afford it. What would you say to them?
I would say, I would probably turn the question around. You probably cannot not afford to do it, right? Because the workforce is changing. So listen to your employees, listen to what they're asking, not just in the words, but really what they're asking. And then figure out, is there a way that you can meet them in the middle? Because again, the workforce is different today than it was 5 years ago, 10 years ago, 20 years ago. And so as employers, if we don't listen and help respond, I do believe we'll be caught behind. And so again, to me, it's, what's the impact if you don't do it in terms of your workforce? And so figure out how to stay ahead of it and be part of that change versus reacting to it when it's too late.
Right. Yeah. So you're saying there is a direct impact on the bottom line.
Yes.
Yeah. Any parting words, any call to action for those who are watching here today?
Yeah, I would encourage everybody here today to join us on this journey towards a healthy future for every child, right? Whether it be through our organization, Nicklaus Children's, or through the children's movement, through some form or fashion. The children are the future of our world, right? I know we hear that all the time. but how do we make their future better? How do we make it better than where we came from? And so making, one positive change today, small change, right? Small changes add up. And then make a change every single day for the betterment of the future of our children, health and well-being. Because outside of our walls, there's a lot more kids than inside the walls of Nicklaus Children's. And so, please join me in making this journey successful for the kids of our community.
Great. Well, thank you so much. In closing, I'll just say, we know that the workforce is increasingly demanding flexibility, purpose, and impact from their lives and from their jobs. And Bosses for Babies is really the only organization working to build a network all throughout the state of Florida of business leaders who champion family-focused practices in their communities, focusing on company culture, leading by example. And you all know why Matt Love is one of those Bosses for Babies. Bosses are active across at least one of our 3 pillars, supporting their employees, advocating, and giving back. And so I would just say, if this sounds like you, or if you'd like to refer a local business to the initiative, please click the link in the chat to learn more. So this will be our final Bosses for Babies Live for 2021. We wish you all a wonderful end of the year and look forward to seeing you often in 2022. For now, please join me in thanking Matt for his time. And again, thank you all for being with us today. Thank you, Matt.
And thank you, Madeline.